Higher Health, the agency mandated by the Department of Higher Education and Training to safeguard student health and well-being, has expressed concern with reports of pockets of COVID-19 infections within student communities as the 2021 academic year gets underway. Higher Health has been working closely with higher education and training institutions, the Department of Health, the National Institute of Communicable Diseases and the National Health Laboratory Service to establish cluster outbreak investigation teams. In the last fortnight, over 3,000 students and staff have been screened and contact traced, and over 300 individuals have been tested. Joining us now to discuss this is the Chief Executive Officer of Higher Health, Dr. Ahluwalia. Dr. Ahluwalia, very good morning to you. Thanks for joining us. Welcome to Morning Live.
Good morning, Simpiwe. Thank you. Thank you for having me.
It's a pleasure, Dr. Ahluwalia. Now, you have expressed concern with reports of pockets of COVID-19 infections within student communities. How rife have infections been amongst tertiary education communities?
In fact, since we found the outbreaks across our institutions and specifically University of Pretoria, we've actually seen now 116 students have become positive in just the last few days alone. So obviously, as we know, the new variants have high affinity to young people. And we are a youth-based sector. If you look at our universities, our TVET colleges, our CET colleges, and they're predominantly like in a congregate setting. So if there is a super spreader event or a party that goes unnoticed, or young people mingle together, or you need few students who become positive, when they come back to their residences, it spreads like a super fire, because they're residing together, they're living together, they're eating together.
Yes.
And then it moves from one residence to the other, it moves to campuses, it moves to communities, it moves to the family. So it is a huge concern, such high numbers of young people becoming positive in such a short time. Plus, we have Easter vacation where some of our contacts might have gone back into their families, into communities. So it is an alert, it is a warning, and we're quite concerned and worried. While we have scaled up our testing and screening numbers to over 6,000 now, so that we can reach as far as possible to every contact and test them, isolate them, so that we can break the chain of this outbreak.
So how does Higher Health interact with the government's higher education institutions and students?
So as soon as we get alert of an outbreak, we develop an investigation team, which is through a protocol. So Higher Health has released a protocol on cluster outbreak. So as you rightfully said, NICD, local Department of Health, WHO, NHLS, we all form one team with the management of the institution. Now, the big thing is with National Health Laboratory System, if we can reduce the time span of the results, so rather than 24 to 48 hours, we can get results, say, in 12 hours. We quickly get to know the results of who are positive and isolate people and quarantine people very, very quickly. And we start doing a massive contact tracing. So it's a very laborious, very difficult job. As I said to you, we've been working over the entire weekend till now because these cluster outbreaks are very concerning. It moves very fast. If you remember the Balito super spreader after the post-metric parties, how the infection spread so many among young people and went to campus, to different provinces. So it's a very similar situation when you find super spreader events or you find a large number of young people becoming positive. So you fear about this outbreak growing, so you have to act very quickly.
Now, the design of student accommodation in our residential universities was was conceptualized with mass living in mind, of course, with limited resources, and now add on to the calls of online learning, which has been touted as the go-to method of learning moving forward. But then South African universities were designed with the traditional methods of teaching and learning. So, in a sense, we're sitting on a time bomb here, isn't it?
See, we are a very vulnerable population. We are young people. The virus shows high affinity to the youth. If you look at the South African data, 21 to 30 is the highest number of young people becoming positive. And the second age group is 30 to 40. And this is exactly where you find in universities, TVET colleges, and CET colleges. Now, you also should know that some of our universities can do remote learning, but our poor and rural universities, our TVET colleges, our CET colleges, the sector is very big, called post-school. You can't teach plumbing, electrical, mining, agriculture through online learning. So we have to continue while living with the virus. And that's why there's a lot of protocols, a lot of procedures, building of about 30,000 frontline workers, training resident officers, training security, training cleaning. These are very important scientific tools that we need to continuously put together all the time. And it's not like this is happening for the first time. We've seen many cluster outbreaks, we survived them. We've conducted about 1.5 million young South Africans on-site exam last year. So there is a lot of work that has happened. The aim is we do not lose the resilience. We have resilience right now. We have to fight this behavior change. There will be these first years coming in. They will mingle up, they'll party, and we need to continuously engage them, find a social compact with them, because there's no way the sector can survive without the youth taking ownership of this pandemic, as much as we can put everything in place together.
Let's talk about your structures such as peer mentors and educators. How does this work?
So we've got a network of about 10,000 peer educators. This been built historically for fighting HIV pandemic or gender-based violence, because these are other major pandemics that remain within post-school system and remain across our youth in the country. So what part was, how can we capitalize on these 10,000 army of young people to become COVID warriors or COVID soldiers for us, which can help us as student volunteers on screening stations. You must remember, we've got about 2.5 million South Africans. We've got about thousands of young people entering our campuses on a daily basis. We've got digital transformation, the form of health check that can check, you can do daily screenings and get a green passport to come in, which is mandatory to come into our campuses. But the role the student volunteers play, the role the peer-to-peer network plays is absolutely the biggest. So far, I must say that post-school education system has had less or far less compared to the total numbers of positivity rates in the general population or in the world of global data of COVID. But it is predominantly that we have youth helping us against the youth. And I think that network is critical and very important, even for now, the new first years that are coming. The reason why most of these outbreaks are happening is because of the orientation month. The first years are coming, they're coming out of the parental control, they're coming into the new system, they're mingling, they're having parties together. So this network needs to now reach out to them very, very quickly and engage in a peer-to-peer format. Otherwise, we might see more outbreaks, and that can lead to us to third waves, and exactly what happened in the previous times.
And having said that then, what sort of measures would have needed to be put in place to mitigate the spread of COVID-19, especially within the student communities?
I think the most important thing is we need to sign a social compact with them. And I know this is just a word, but it's a very important information or work to them. They need to take accountability of their lives and to accountability of others' lives. So I think with the help of student leaderships, with the help of management unions, we're building this social compact among each other. Now, there are various protocols. There are about 30,000 frontline workers that have been capacitated and trained. But all this will be meaningless if the young people do not take control of this pandemic with us. Youth are the biggest carriers of this virus at the end of the day. They have high affinity to the virus. They can spread the virus very quickly. They are mostly asymptomatic and mildly symptomatic, but they take the virus to their families, to their communities, to our academics, who actually fall in prey to high fatalities due to the carrying of this virus. So I think a social compact, following those severe protocols, the management has made sure that our classrooms are adjusted to the size of how students will sit. Our exam protocols are very clear, where how each and every student comes into the exam, the preparation before the exam center, the invigilation, the quarantine of exam papers before they go. So there's a whole process that happens, but the process can get delineated if our young people do not commit to support us. And through you as a media, we appeal to parents, guardians, to young students who are going to come back on the 6th of April after the Easter holidays to make sure that they bind themselves with the social compact of physical distancing, wearing a mask, and ensuring that they do not indulge into any parties. They confine themselves to academics, to the way the COVID protocol has put things into together, because they are a very sensitive community that can lead us to a very severe damage, as not only as post-school system, but as the country in general.
Now, dealing with mental health of students, Dr. Ahluwalia, I mean, given the pandemic, again, what is best recommended for a student who simply cannot access your services for some reason?
So I will plead through a number. It's 0800 363636. And I repeat, 0800 363636. It's an absolutely toll-free crisis helpline for every student in post-school system. It's open to every 2.5 million South African, even if you are in private higher education. The aim is to reach out 24 hours, whether it's 2 o'clock in the morning, 3 o'clock. COVID is absolutely real. There are bereavements in your families. The exam stresses are there. Uncertainty about an academic year. Challenges of remote learning. Your own parents, guardians, and family are losing jobs. There's poverty. There is a real challenge, and there's a huge pandemic in South Africa where mental health is predominantly very high. We've seen huge numbers, Simpiwe. We have actually received 10,000 crisis lines just in last 4 months of launching this.
Wow.
But we appeal to more. The aim is to reach out, because you should not find yourself alone at 2 o'clock or 3 o'clock or any time, and ensure that this is not one call. These are series of crisis calls, referral to psychologists, referral to a counseling unit, and to ensure that you're looked after.
And adding to that, the death of a breadwinner in the family as a result of COVID-19 that leads to pain, hunger and suffering, especially in the vulnerable communities. And what's more concerning, Dr. Ahluwalia, is the fact that so many students have lamented that, they do not live in an open and free society where there's diversity for all, where there's equal opportunity for all, especially in the student communities, because there's lack of support, especially those who come from rural backgrounds, lack of academic support, lack of financial support, and this will ultimately lead to to mental health challenges.
Absolutely. I think this is real. This is absolutely, to be very honest, this is the reality of us as a country in general. We are a poor country, to be very honest. It's a myth and a misnomer that we are a rich country. There's two South Africa in the same South Africa. There are a few universities like UCT and WITS and UP, which can hold on to remote learnings that are very strong. But we also have the same sector with TVET colleges, CET, which is in rural areas, informal settlements. They take care of about 1 million South Africans into the entire system. And there's no way you can learn, or even practical learnings like plumbing and electrical, where TVET colleges teach you skills remotely. So I think it's in entire fairness, and that's where we as higher health, from the very beginning, build systems that are equal for all. So it's toll-free telephone line, crisis lines, and it's a data-free USSD system, or a WhatsApp system, or a web form system for daily health check. Whether you are in a rich university or a poor university or a TVET college, you have to do the risk screening every day. You have to get a green passport before you enter the campus. We have to do this so that we can allow thousands of people to still come and do saving the academic year while studying on the campus, but also making sure that they're screening their COVID, they are testing their COVID on a daily basis, and we are limiting the prevention of spread of this infection virus. So the reality of us as South African globally is that we have to now learn to live with this virus. This virus is here to stay with us. Vaccines have started. It is an enormous journey that we will do as a country to get vaccination drive. We do not know what's post-vaccination. The question is, will vaccination be enough to eradicate the virus? These are very difficult questions at this hour to answer. But one thing we know is that we can prevent the spread of this virus through behavior change. And that is exactly what we need to know. Otherwise, we can't save our economy. We can't save academics here. We can't save developing our skills into this country. And the young people can only work, and the hope of the mother who's on this child to come out and work will only happen if this child has a skills development process behind him, or a degree or a qualification. And we need to continuously work together. And as a family of parents, guardians, community, us, so that we can fight this together. And I think that's a reality for this. And we need to embrace the reality that this virus is bound to stay, and we need to learn to live with this.
Well, the biggest fear as we were moving into the Easter weekend, Dr. Ahluwalia, was that the Easter weekend would see a bloodbath in terms of infection rates. But then, since we have already concluded the Easter weekend and the data that has been coming through from the health authorities suggests that a third wave potentially, is not so, their realization is not so real of the third wave. So the biggest danger here is that people, seeing that we are out of the woods, would regress to being reckless in terms of taking all the necessary precautions, especially the students.
I'll remind South Africa of how the second wave started. If you remember, the post-metric results came. There were young people who had congregated together into Balito, or other places where they had rage parties. And then so many young people at one time became positive. They went back to their families. It takes time. And then the families and the communities, they mingled around. The positivity level started changing one person to the other, and it became a super spreader to a community outreach of so many people becoming positive, and then our hospitals become flooded, and we call this as a second wave. It takes a long time for a second wave to build, but it builds from somewhere. And when you have more of the virus transmitting from one individual to the other, you're also allowing the virus to mutate and develop into new different variants that tries to escape antibodies, that tries to escape your system of immunity and tries to become more aggressive. Remember, the virus is trying to be also surviving like we are surviving with the virus. The virus is surviving by moving from one individual to the other and transforming so that he can live nicely into a human body and defeat the human body. So we are in a war against this virus. So yes, I must say, as much as the results are low, and I pray these results remain low, but people are not following behavior. And the young people, these cluster outbreaks gives us indication the virus is still around our communities. People are becoming positive. They are, and the worry for Easter weekend is that same positive people will go back into their families, into the communities, mingle with them, and the virus can spread, and the chain of the spread can be. We might have a variant which is absolutely mildly asymptomatic or low in terms of virulence, and we pray for that. But for heaven's sake, we do not get what Brazil is facing right now, what India is facing right now, what US has started experiencing its fourth wave, what France has already put themselves into lockdown due to their new variants that have come into transmissibility. Yes. South Africa can experience. We can experience. So I think I would not go with the data for now. I would keep the alert on. I would keep the caution on. The cluster outbreaks are showing the virus is still moving. 116 young people did become positive. So the reality is South Africa needs to be vigilant. People need to be vigilant, and the virus needs to be tackled through our social compact and through our behavior. And through media, we need to keep emphasizing this and reaching out to families and educating people.
Indeed, and we certainly can never overemphasize the importance of that point you've just made there, Dr. Ahluwalia. Thank you so much for joining us, and we certainly hope that our country's universities do have a contingency plan and a school recovery plan to save the integrity of the academic year should, God forbid, the third wave strike us, because we cannot turn our backs and our focus on the reality of a possibility of a third wave. Dr. Ahluwalia, great chatting to you. Thank you so much for your time. That was the CEO of Higher Health, Dr. Ahluwalia, and was talking to us about the concerns around COVID-19 transmissions.